Mulligan mobilization, hands-on techniques for improving movement and relieving pain. Hello, wonderful attendees. I'm your host, Dalvinder Kaur from lovely Professional University. Get ready to dive into today's topic, that is Mulligan mobilization, a manual therapy technique. Before we proceed further, allow me to introduce the experts of the day. Dr. Varun Kalia, Assistant Professor, Department of Physiotherapy, Lovely Professional University. With extensive experience in manual therapy techniques, his deep understanding of Mulligan mobilization, which combines sustained manual pressures and active patient movement to address musculoskeletal issues, makes him an ideal speaker for today's topic. And now I would like to introduce the admission nominee also in this webinar, Dr. Tushinder Preet Kaur, a distinguished professor at Lovely Professional University, Mittal School of Business. With over 15 years of academic experience, she holds a doctorate in economics, MPhil, and UGC NET qualification. Dr. Kaur is also an author and served as a resource person for seminars and conferences. Before we proceed further in today's session, I would like to request everyone for any questions. You can write in the chat box or in the Q&A box, and same will be addressed from my side in the end of this webinar. And now I hand over the things to Dr. Varun Kaliyaji, and it would be an absolute delight to listen from him. Over to you, sir.
Thank you, ma'am. Thanks a lot. So let's start our today's talk. So today I'm going to talk on the topic Mulligan mobilization with movement, that is MWM. So if we will see the definition of this topic, so it's a concurrent application of sustained accessory mobilization applied by a therapist and an active physiological movement to end range applied by the patient. So here we have two things. The first thing, application by the therapist over the patient's body. That is the sustained accessory mobilization that we have to apply over the patient body. And the second thing, we can teach the techniques to the patients also, so that at the home, after the completion of the session, patients can also do the same thing at the home and they can get the benefit. So that is the active physiological movements to the end range applied by the patient. So how to apply? By the physiotherapist as well as by the patient. So let's discuss all these techniques here. So first of all, when we have to apply any technique, so the principles of those techniques, actually, it's very important to understand. So first of all, we will see some of the principles of the Mulligan mobilization. So the first principle, the application of the accessory glide must be pain-free. That means when we have to apply a Mulligan glide, or we can say the accessory glide, so that glide must be pain-free. For example, if some patient will come to us in our OPD or in our hospital settings or the setup, so that patient will come to us, so that patient will come with the pain. But when we have to apply this glide, or when we have to apply the Mulligan mobilization, so our treatment must be pain-free for the patient. If during the application of the treatment, patient reports some pain, that means our treatment is not sufficient for the patient, or we are applying some wrong technique over the patient body. Then we have to think again. Either we have to change our treatment strategy, or we have to implement the treatment in a correct way. So that is the first principle given by the Mulligan. So next one, during assessment, the therapist will identify one or more comparable signs as described by the Mulligan. For example, here a loss of joint movement, pain associated with the movement, or the pain associated with the specific functional activities. For example, if I have to apply some...
Sorry for the interruption. Dr. Varun, can you please share your screen?
It's not visible?
No, it's not visible.
I'm sorry, ma'am. Just a minute.
Share your screen first. There are so many participants are with us. Kindly share your, yes. Yes, the screen is visible. You can continue.
Okay, thank you, ma'am. Okay, so again, we will see the definition first of all. So here, so first of all, if we will see the Mulligan mobilization, so here we have the two concepts. The first one, when therapist will apply some technique to the patient's body. So that is coming under the sustained accessory mobilization applied by the therapist. So that means we have to apply this mobilization on the patient's body. And on another side, if we will teach the patient itself how that patient can apply the mobilization on his or her own body. So that is coming under the active physiological movements to the end range applied by the patient. So these two concepts actually we have to carry on. So first of all, we will see the principles. So Mulligan gave some of the principles related with this technique. The first principle given by the Mulligan is the application of the accessory glide must be pain-free. That means when we have to apply any technique over the patient's body, so that technique must be pain-free. For example, if some patient will come to us in our OPD or in our hospital setup, so that patient will come with the pain. But during the treatment, when we have to apply the treatment over the patient body, suppose I have to treat the neck of the patient because patient came to me just with the neck pain. So when I will apply this glide, so that glide must be pain-free. That is the first principle. If during the application, patient will report some pain, that means either my treatment choice is wrong or my technique is wrong. So I have to check whether I have to change the treatment choice, means I have to give some another treatment, or I have to correct my application of the treatment. So the second principle, during assessment, the therapist will identify one or more comparable signs as described by the Mulligan. So here, if some patient will come to me with the neck pain, and if I will give some treatment, but still patient is reporting some of the painful symptoms, so I have to check whether those symptoms are just because of the problem in the neck or because of any other reason. For example, if someone is having a loss of the joint movement, the patient is not able to move the neck, but if I will give the glide, Mulligan glide over the neck, so it might be it will not give some instant relief to the patient, as well as pain associated with the movement. So if a patient is feeling some pain associated with the pain movement, means if I will ask the person to move your neck and during the movement patient is feeling some pain, that means my technique is not correct. I have to correct my technique so that the movement must be pain free. So pain associated with the specific functional activities. For example, if I will ask the person to just flex your neck or move your neck up and down, so during that activity only patient is feeling some pain, then we have to target that specific activity only, not the all other activities. But we have to first of all check. Well, first of all, we have to go for the assessment, whole assessment. What are the movements are restricted, what are the movements are painful. Then only we have to target the issues. And the last one, that is the while sustaining the accessory glide, the patient is requested to perform a comparable sign. The comparable sign should now be significantly improved. If patient is feeling some pain before the starting of the treatment and during the treatment, I will ask the person whether you are feeling some pain or not. So in that case, if patient will report that I'm not feeling any pain during the application of the treatment, that means my technique is correct. So after the completion of the treatment, immediately I will again ask the patient whether you are feeling the same symptoms as the previous one, means before the treatment, all your symptoms are relieved. So if patient will give me the response ki now symptoms are already relieved, that means my treatment was successful. So all these are the principles of the Mulligan. So except these principles, we have one Crocs principle. Crocs principle means C stands for the contraindication. Means first of all, we have to check for the contraindication, whether the patient is having some of the contraindications or not related to the Mulligan mobilization. If some patient is having some fracture in the neck or in any other area of the body where we have to apply the treatment, so in that case, we can't apply the Mulligan mobilization. So overall, we have to check the contraindications. Next, repetition. So how many repetitions we have to give? So when we have to apply this technique in the first session, so we have to obviously give the less repetitions, so that if we will give more repetitions, might be it will increase the symptoms of the patient after the treatment. During the treatment, patient will be comfortable, but after the treatment, might be patient will feel more pain. So that's why we have to give the less repetitions during the first treatment, but in the upcoming treatments, we can increase our repetitions slowly and slowly. Then the overpressure. So we have to decide how much pressure we have to apply during the mobilization technique. So if we will give the overpressure, so obviously it will compress the soft tissues which are present on the outside the hard tissue, means outside the bones. So obviously we have to never apply the overpressure. We have to exert the adequate amount of pressure only, so that patient will feel comfort. So next one, communication. Communication means while the application of the treatment, we have to communicate with the patient. Never we have to just implement the treatment. So during the treatment application also, we have to talk to the patient. So how much pain you are feeling, whether you are feeling any pain or not, if you are feeling your pain, whether your pain is reducing or increasing. So such type of the questions we have to ask continuously to the patient, so that we can get the feedback from the patient, instant feedback from the patient, whether our treatment is successful or unsuccessful. Then the knowledge. So here it's very important for the therapist also to have the complete knowledge regarding the Mulligan mobilization. We have to decide in which position we have to apply the treatment, in which position of the patient we have to apply the glide. If, for example, if we have to apply the glide for the cervical region, for the neck, so if I will apply the glide during the supine position or the sideline position of the patient, so it must not be effective for the patient. So in that case, I will always apply the treatment in the sitting position. But again, we have to check the pathologies also, whether the patient is having some severe pathology or not. If patient is having the pathology in which there are lots of chances for the giddiness or some chakkar aana jise bolte hain, so in that case, obviously we have to give the comfortable position to the patient in the supine lying or in the side lying or in the prone lying, that is also suitable for the therapist. Then only we have to apply the treatment, because if we will apply the treatment in the sitting positions, obviously there are lots of chances the patient will feel some giddiness and patient will just go for the fall. So in that case, we have to prevent the fall. So we will ask the person to just lie down over the couch in the prone position, in the supine position, or in the any other comfortable position, and then only we have to give the treatment. Then sustain the mobilization throughout the movement. So here, it's also a very important principle of the Mulligan when we have to apply any glide. So, and after the application of the glide, we have to ask the person to now you have to move your body part. So when patient will start the movement, from that point only we have to give the treatment, we have to give the glide, and when patient will complete the whole movement, and when patient will come again back to the neutral position or in the starting position, so till that point we have to apply the glide. In between, never we have to stop the glide. Okay, we have not to reduce even the force of the application of the glide also in between. If we will stop the glide in between, or if we will reduce the force in between, so obviously it will give more severe symptoms to the patient, because it will impinge the nerves which are coming outside from the joints of the cervical spine, or we can say any other region also of the body. So what are the contraindications we have to check in the patient before the application of the Mulligan mobilization? So here the first one is the joint infection. So in case of joint infection, we have to avoid the Mulligan mobilization, or we can say any other type of the mobilization also, because there are lots of chances of the joint destruction in case of the joint infection, because just because of the joint infection, joint will become very feeble as well as very soft. So when we will apply some vigorous force over the joint, so it will create some destruction in the joint also. So that is the reason we have to avoid the implication of the mobilization. So joint inflammation, again, we have to reduce the inflammation first of all with the help of other treatments like the ice therapy. Then only we have to go for the Mulligan mobilization. In case of joint inflammation, or we can say the pain, if patient is having a more severe pain, then we can use the Maitland first of all. And with the grade 1 and grade 2, we can reduce the inflammation as well as the pain, and then only we can go for the Mulligan mobilization. So we can say this joint inflammation is not a pure contraindication, but we have to take care the condition. Then rheumatoid arthritis. So in this case, the same thing. Again, if we will apply the Mulligan mobilization, so there are lots of chances for the joint destruction. So we have to take care of the patient. We can apply the mobilization in this case, but we have to take care of so many things. Then only we can preserve the joint. Then the bone cancer. So in this case, again, we have to contradict. Means if person is having the bone cancer, so in that case, over that bone, or we can say nearby that bone, the joint which is present, so we have to avoid the mobilization, because there are lots of chances for the bone cancer spread also, as well as the fracture also. So it can lead to the fracture of the bone also. Then the osteoporosis. So it's again not a pure contraindication, but we have to take care. If person is having a severe osteoporosis, then obviously we have to contradict it to the implication of the technique. But if the person is having the, we can say, starting of the osteoporosis, then we can implement the mobilization with the precaution. So in that case, we have to control our pressure. There is no need to give the much of the pressure over the joints or the bones, so that it can not lead to the development of any fracture or any other type of the complex complications. Okay, so in case of pure bone fracture, we have to obviously prevent the implication of the joint mobilization, or we can say the Mulligan mobilization. If person is already having the unstable joint, so in that case also we can't apply the Mulligan mobilization. So if joint is already unstable, so there are lots of chances of dislocation. So if we will apply the Mulligan mobilization or any other type of the mobilization, so there are lots of chances for the subluxation also, as well as the dislocation also. So joints can go for the dislocation very easily. So in that case, we have to avoid the implication of Mulligan mobilization. If it's very important to apply the glides, so then we have to take care lots of precautions. Then only we can apply. So we have to stabilize the joint first of all, then only we have to give them mobilizations to gain some range of motion. But most of the time we have to avoid. Next is the repetition. So we already discussed during the first session, actually we have to give the less repetition. So if you will see in this screen, so here we have the spine as well as the peripheral joint. If we have to give the mobilization for the spine, so in the first session, we can give 3 repetition in a single set only, not more than that. So in the second session, means on the alternative days when patient again come to us, then we can start with the 6 to 10 repetition. That depends upon the condition of the patient, whether the patient is having the severe symptoms or very mild symptoms. If patient will report a very mild symptom, then we can give only 6 repetition. If patient is having somewhat more severe symptom, then we can increase a little bit of the repetitions in set 3 to 5. So if I will share my experience, then I will give only 3 sets on the second or the third, as well as the subsequent sessions with 6 to 10 repetitions. And in case of peripheral joint, in the first session, we can give 6 repetitions for the 3 sets. Okay, so in this case, we can give the 3 sets with the 6 repetitions, not more than that. And most of the time, actually, we can give 1 or 2 sets only, not even the 3. Because in this case, there are lots of chances of the increase in the symptoms again. So we can reduce the repetition as well as the sets according to the condition of the patient also. And in case of peripheral joint, subsequent sets, the subsequent sessions, we can give with the 6 to 10 repetition for 3 to 5 sets again. So again, we have to decide according to the condition of the patient, present condition of the patient. So if today I have to give the session, so I have to again assess the patient, what is the status of the patient's symptom. So if the patient's symptom is already relieved, so there is no need to give the vigorous session. So I will reduce the repetition as well as the number of sets. But if patient is having the mild amount of symptom, then obviously I will give mild amount of the repetitions also, as well as the sets also. So according to the conditions of the patient, we have to change our treatment plan on a daily basis. Next is the pill response. So what is pill response? The first one is the P stands for the pain-free, that I already told you. So if we have to give some treatment to the patient, give some mobilization to the patient, so that mobilization must be pain-free. That is the most important principle of the Mulligan. then instant result. So it's a magical technique actually. We can say it's a magical technique because when patient will come to us with a severe pain and if we will apply this mobilization, Mulligan mobilization, so after the completion of the session, patient will report huge amount of the reduction in the symptoms. Suppose if I will ask the person, you have to tell me how much pain you are feeling from the scale 0 to 10. In the starting, if patient will report 8 score, I'm having a severe pain. But after the session, obviously patient will report pain less than 5 or 4. So that's why we can say it's a magical technique. With a single setting only, patient will give us the positive response. Then the long and lasting. So if we will apply the Mulligan mobilization, so patient will give us the response for the long lasting. Means if I will give a single set to the patient of the Mulligan mobilization, so patient will give me the response key that patient is not feeling much pain for the next few days. It's not like only for the 1 day or for the half day or for the 1 hour it will relieve the pain or it will relieve the symptoms. It will give a long lasting response to the patient. So here we have few of the techniques. So now we will discuss about those techniques. The first one is the NAGS. NAGS means natural apophyseal glide. Natural apophyseal glide means the glides that we have to apply over the patient body. So here I will try to demonstrate a few of the glides to you. So I have one model with me. So I think so model is visible to everyone.
Yes, sir, it's visible. You can continue. So
Okay.
stop sharing your screen that we can see on our whole screen, full screen.
Okay, ma'am. Yes.
Yeah, stop sharing your screen.
Stop share.
Thank you.
It's stop now.
No, it's you just stop sharing your screen that we can see this technique on full screen.
Now it's visible on over full screen.
No problem, sir. You can continue. No problem.
Stop share.
Yes.
I think so now it's visible.
Yes, it's visible now. It's visible. You
Okay.
can continue. You can continue.
Okay, suppose this patient is having some pain in the neck. So in that case, first of all, when we have to give the natural apophyseal glide, so here we have to find out the spinous process of the cervical spine. So in this case, on the posterior side, we have the spinous processes, and on the anterior side of the patient body, we have the body of the vertebrae. So suppose patient is feeling some pain over the C6 vertebra. So we have to first of all find out the prominent vertebra, which is the most prominent one. So just one level above to the prominent vertebra, we can find out the C6 level, or we can say the C6 vertebra. Then we have to apply a glide over that vertebra. So in that case, we will use our thumb. So I will place my thumb from the medial side over the spinous process of the vertebra, and then to reinforce, I will use the another thumb of my another hand. So in this way, I can give the glide. Okay, so let's see. So here, I will just apply the glide. So I have to hold the vertebra with my thumb, and with the another thumb, I will just reinforce my force. But here I have to check the force application. So to verify whether my force application is correct in the direction, so in that case, I will use my both the fingers. So I will use my both the fingers. So my fingers must be toward the eyeball of the patient like this. Okay. So in that case, when I will apply the glide, I will apply the force. So my fingers must be toward the eyeball, and then I will ask the person to just move your head down as well as up. परमिंदर अपना हेड नीचे और ऊपर करना, ऐसा नीचे और ऊपर करना है आपने, ठीक है? हाँ करो, नीचे करो दोबारा. Yes. So when patient will move the head down, side by side, my fingers will also move along with the movement of the eyeball. So when patient will come back to the normal position or in the starting position, so in that case, I will then only ask the person to stop. Again, Parminder, वापस आओ. Yes, now stop, 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 stop. There is no need to movement. Okay, when patient will stop his or her movement, then only I can move my hand. I can remove my force. So till that time, when the person will doing the movement, so at that time I have to maintain my forces. So that is the natural apophyseal glide. That is the NAG. Second one is the sustained natural apophyseal glide. Okay, sustained natural apophyseal glide. Again, so again we have to do the same thing. So in this case, again, we have to find out the spinous process of the patient, and then we have to apply the same type of the glide. And we have to maintain that glide for the continuous. So here, one question is, what is the difference between the NAG and the SNAG? Natural apophyseal glide as well as the sustained natural apophyseal glide. So in case of sustained natural apophyseal glide, actually we have to not to stop our force, but in case of natural apophyseal glide, we have to try to give the long force or the continuous force, but we can stop our force in between. So natural apophyseal glide we can give in the another way also. So another way, what is another way? So in that case, we can stand with the patient on the side, and then we can palpate the spinous process of the patient where we have to apply the glide, and then we can use this pinch grip over that particular vertebra, and then only we can apply the glide like this. And again, we can ask the person to just tell me whether you are feeling any pain or not. If patient is feeling the pain, that means my glide is not correct. Then I have to check the technique. But in case of change, we have to continuously give the glide, and then only we will ask the person to move your head and neck up and down, or for which moment actually we have to give the glide. So that moment patient will perform, and then only we have to leave our pose. So this is the difference between these two glides. And next we have the reverse NAG, reverse natural apophyseal glide. So reverse natural apophyseal glide means now we have to give the natural apophyseal glide, but in a reverse manner. So in the starting, in the first one, we gave the glide from the posterior to anterior. But if after one session, patient is reported, patient will report, I'm not having that much of we can say significant result. Means significant pain reduction have not done. So in that case, we can use the reverse snag also. So in that case, we have to maintain the same position of the patient, and then we have to apply the same pinch grip. But in this case, we have to give the glide from the head to the posterior side, not from the hand to the anterior side, like this. Okay, from posterior side to anterior side, actually, we have to give the glide in the natural apophyseal glide. And in the reverse case, we have to give the glide from the anterior to posterior with the head only, like this. So that is the difference between the natural apophyseal glide as well as the reverse natural apophyseal glide. Then we have the movement with mobilization. So movement with mobilization means when we have to apply any glide. So along with the application of the glide, patient will also participate. So in that case, for example, this patient is having some pain in the shoulder, and patient is not able to move the shoulder in the abduction, means on the side. Okay, so in that case, therapist will just stand on the another side of the patient, and then we have to apply the glide. Apply the glide means one hand will just stabilize the scapula of the patient, and another hand actually we will use to give the glide over the head of the humerus. So my force from both the sides. So it will just make a neutral position of the head of this joint, shoulder joint. So after maintaining this glide, I will ask the person to move your shoulder. रविंद्र, अपनी आंखों पर लेके जाओ. Side one. Yes. So like this. So during the moment, no, ऐसे. दीदी हमें पहले इसको सीधा ऊपर लेके आना है when I will ask, जब मैं बोलूंगा, ठीक है? So in that case, when I will apply my glide, I will hold that glide and I will ask the person to move the shoulders like this. So the patient have to gain a new range of motion for the shoulder joint, and the movement must be pain-free. So the movement must be pain-free. That is the most important principle of the Mulligan mobilization. And when patient will again reach to the neutral position or in the starting position, then only we have to leave the force. Yes, complete. Okay, so like this, we have to apply the movement with mobilization. So for any other joint also, we can apply the same type of the treatment or the glides. Then next is the fist traction. Fist traction is the another technique that we can teach to the patient also. So in this case, actually, if person is having some stiffness in the neck and patient is feeling some pain as well as the stiffness while doing the flexion of the neck as well as the extension of the neck. So in that case, we will ask the person to just make a fist of your hand, and then patient will just hold that fist over the sternum, the point, this superior aspect of the sternum. And then we will ask the person to just place your chin over the fist. And then with the another hand, patient will just hold the head and force anteriorly. And patient will give the force anteriorly. So it will open up all the tight structures. So obviously it will give some relief of the tight structures. So obviously it will give some relief of the neural column. So if patient is having the pain, radiating pain on the both sides, so it will give an instant relief to the patient. Traction technique of the Mulligan mobilization. Self snag. So in this case, we have to teach the technique to the patient. How person will apply self snag. Or we can use this towel also. We can use this towel also. So in that case, we have to take a towel and then suppose we have to apply this technique for sustained natural case. I will just hold both the arms of the towel with my both the hands, and then I will maintain the arms at my eyeball level. So when I have to apply the force, I will pull both the arms anteriorly. So it will give a glide over the vertebral column, or we can say the affected vertebra. And at the same time, I will also move my head up and down. So here again, we have to apply the same principle. So when we have to move our head up and down, so during that time duration, we have to maintain this force of towel. But when I will again come at the neutral position or in the starting position, then only I can relieve my force. So that is the sustained natural apophyseal glide by the patient, or the self snag, we can say. So here we have the last technique, that is the spinal mobilization with the limb movement. So here we have to apply the spinal mobilization with the limb movement. So in that case, if person is feeling some pain in the thoracic region, so in that case, therapist will just stand behind the patient, and then we have to palpate the spinous process, which is painful. In that case, we have to just again use the pinch grip only, and then we will apply the glide by holding the spinous process of the affected vertebra. We will just ask the person to sit straight first of all, and then we will apply the, or we will just glide the vertebra anteriorly, means posterior anteriorly. At the same time, we will ask the person to move the shoulder joint. Okay, means we have to move the nearby joint, which is present nearby the affected area. Suppose here I have to treat the thoracic spine, and then I will apply the guide, and then we will ask the person to just move your nearby joint, that is the shoulder joint. So when person will move the nearby joint, so during that time duration, we have to hold the force, and after the completion of the glide, we have to remove the force. So all these are the techniques of the Mulligan mobilization. Yes, I think so. My screen is visible now again.
Yes, the screen is visible.
Okay, so we discussed all these techniques in this small session. So next, I would like to discuss some of the highlights of the physiotherapy department in Lovely Professional University. So here we are offering some undergraduate, master, as well as the PhD programs in the physiotherapy. So under the undergraduate program, here we have the bachelor in physiotherapy for the 4.5 years, as well as we are also offering some lateral entry in the BPT. And under the master program, we are offering master in physiotherapy in various fields like the orthopedic, neurology, sports, cardiopulmonary. And under the PhD program, again, we are having the various fields like the orthopedic, neurology, sports, cardiopulmonary, and so many other fields also we are offering in the PhD also. So here we have a huge diversity in the students. So here we have students from the so many countries. So you can see from the Zimbabwe, Zambia, Yemen, Tanzania, Syria, Sudan, Sri Lanka, and so many countries. Actually, we are having the student in the physiotherapy department. So some of the alumni that I also like to discuss here. So here you can see the Ishan Marwaha. So he's the alumni of the physiotherapy department, and he's working as a personal physiotherapist of the golden boy, Mr. Neeraj Chopra. Okay, so I think so everyone aware about the Neeraj Chopra now. So Mr. Ishan Marwahi is also alumni of the physiotherapy department of LPU. So again, we have the Amreen Hayat, Vikas Gautam, as well as the Shobhan Babu Komu. So all these alumni are working very well in the so various teams, national as well as the international sports teams. Some other physiotherapists here again, Dr. Firoz, Kamaldeep Singh, Surbhi Bhardwaj, Amit Chaudhary. So all these alumni are also working in very good institutions where they are earning very good. We can say these are the very, we can say our proud alumni of the LPU. So here we have some of the placements of Jocelyn, Ovijit, as well as the Jasjot, Purnima Vaiswal in the various hospitals as well as the institutions like the Fortis, or we can say the St. Francis Medical Hospital, Handicap International Federation, Cord Life Science India Private Limited. So all these alumni are working very well in all these good institutions. So here actually we have some of the tie-ups for the clinical training, means when student will just enter in the third year. So from the third year as well as the fourth year, even in second year also, we have to send the students for the clinical training as well as the clinical posting. So we have some tie-ups in the Jalandhar as well as in the Fagwada also. So here we have some of the hospitals. So Guardian Hospital, Osnova Hospital, Gandhi Hospital in the Fagwada, Sikha Hospital, Sacred Heart Hospital, and so many other hospitals also like the DMC, Johal, NHS. So all good hospitals are we have some tie-up with those hospitals. So in our department, actually, we have lots of research activities also. So under the research activities, actually, on a daily basis, actually, we are doing some of the innovations. So you can see here we have the DT walk as well as the Gati, that is the gait analysis through insole. So all these are the products that developed by the students only. So all these are the outcomes of the research that is going on in the LPU campus under the physiotherapy department. So industry tie-ups also we have like the Copper, Surgical, as well as so many other companies also we have the tie-ups. In those companies, actually, we can place our students as well as the students can also get the job in those very good companies in the national as well as the international setups. So time to time, actually, physiotherapy department is organizing some of the workshops, hands-on workshops. So today, actually, we just completed our online session, but in the physical mode also, LPU physiotherapy department is organizing workshops time to time. So these are some of the glimpses of those workshops. So in this second image, you can see the very renowned therapist, Dr. Uma Shankar Mohanty. So he is a manual therapist and he is a very renowned therapist who visited LPU so many times for the workshops. So here, Dr. Ghazi from the Jammu Kashmir. So you can see that Dr. Ghazi also visited LPU so many times for the workshop as well as for the conferences also. So here, most of the time we have to organize the camps also. So those camps we are organizing in the villages as well as in some hospitals also. So all these are the glimpses of those organized camps also. So we have some links as well as the tie-ups with the prominent industry speakers. So here we have lots of speakers, Dr. Shan Petman, Dr. Arun, Dr. Justin from the international speaker, or Dr. Bimal, Dr. or Professor Ali Rani. So all these are the very renowned speakers of the in the physiotherapy field. So these speakers used to visit LPU time to time for the guest lectures as well as to conduct some of the workshops as well as the conferences. So I already told you in this physiotherapy department, actually, so many researches are also going on. So in the last year, we published almost 271 scopus as well as the Web of Science indexed publications, as well as the 360 publication, which are again we can say we received 386 citations for the 271 published papers, and we already done 41 IPRs published, means patents as well as the copyrights we already published. So 9 patents already granted, as well as we have the funded project. So we already having the funded project of more than 8.5 crores also, that is already going on under the spirit. So in the similar way, we have so many other tie-ups with the industry or with the research industry also. So that I already discussed the project which is already under the spirit is going on. That is the almost about 8.5 crore. So you can see here we have the tie-ups with the LPU, with the Edu-Lab, ISBR, IPB University. So other international universities also are coming under that spirit project to work together. So here we have so many laboratory facilities also. So you can see EMG and CV facilities available, wind check facilities available to check the balance as well as the gait. Spirometry is also available. So we have some of the sophisticated microscopes also to perform some of the good researches, as well as the block warmer for IVF also, ECG also, and so many other laboratory facilities are also already available in the university for the practice of the students also, for the benefit of the patients also. So you can see here under the labs, we have the gate training. So this is the wind check machine. So with the help of this machine, actually, we can assess the balance as well as the gait of the patient. So in Punjab, I think so 1 or 2 institutions only having this highly sophisticated machine or the instrument to check the balance as well as the gait. So in these laboratory settings, actually, we are used to check or used to assess the patients also, as well as we are giving some training to the students also. So here we have some of the collaborations with the researchers or the research institutions, like the you can see here some of the institutions from the Brazil, Portugal, Cyprus, and so many other countries also, even in the India, Indonesia, Sri Lanka, Spain. So with the another international research institutions also, we have some of the collaborations. So all these are the hospitals. With those hospitals, actually, we have the already tie-ups where we are used to send our students for the clinical practice as well as for the research activities also. So all these are the activities that are going on a daily basis in the physiotherapy department. So all these are the activities as well as the laboratory setups that you can see over the screen. So these are the practical sessions which we used to conduct on a daily basis. So all these are the laboratories like the neurology lab, cardiopulmonary lab, where we can assess the neuro patients also, where we can give the treatment to the neuro patients, as well as under the cardiopulmonary, we can give the treatment to the cardio as well as the pulmonary related condition patients. So here you can see all the laboratory facilities we have. So these are the OPDs actually we have. Under the LPU campus, again, we have one OPD, outpatient department for the physiotherapy. In the Fagwada also we have one OPD, as well as in the Jalandhar nearby the Nakoda Chowk, again we have one OPD. So under these three physiotherapy OPDs, our students are doing a huge amount of practice to how to treat the patient, how to assess the patients. So along with the students, actually, our the faculties are also assisting the students where students are having some of the doubts. So we have to clear those doubts at the same time. So next is we have the very good as well as the established department and library, central library also we have. So with that library, we have lots of books. So more than 1,500 books as well as the journals, we can find it out in under the libraries. So under the library, we have the access for the JCAT also, Springer also, Embase also, as well as the other platforms also. So all these access actually we are getting free of cost. So university is providing us the access for all these platforms. So time to time, LPO is organizing some of the guest lectures. So you can see the images of those guest lectures. The first one for the Pilates lecture, second one, motor competency assessment, third one, oncology, rehabilitation. And in the similar way, LPO used to organize so many guest lectures as well as the conferences as well as the workshops. So all these glimpses are about just the Department of Physiotherapy under the LPU. So thank you from my side. Now mic is over to ma'am.
Thank you so much, Dr. Varun. So it was wonderful watching you talking on a principle of the treatment, contradiction, programs offered by lovely professional university in physiotherapy. If anyone have any queries, you just write down on the admissions@lpu.co.in. Our experts will definitely address your queries as soon as possible. So now can we take questions, Dr. Varun, from our participants? Can we take questions? Dr. Varun, unmute yourself. Unmute yourself, Dr. Varun.
Yes, ma'am.
Yes. Megha is asking here, how does Mulligan mobilization differ from other manual therapy techniques in terms of its approach and application?
In terms of?
In terms of its approach and application.
Approach and application. So here, actually, I already discussed the Mulligan mobilization includes the movement with mobilization. That is the specificity of this mobilization. So if we will see the Maitland mobilization or the carton ball mobilization, so in those techniques, actually, there is no need for the patient involvement. So patient will not do any movement. So only therapist will perform the activity. Therapist will apply the technique, but under the Mulligan mobilization, therapist will also work side by side, patient will also do the activity. So that is the specificity of the Mulligan mobilization. And only we can say, if you will see the Carlton Bond as well as the Maitland in comparison to the Mulligan. So Mulligan is the magical technique. So with my own experience, actually, I'm saying this thing. So Mulligan is the magical technique, and with the one session only, we can give relief of more than 70 to 75% in the symptoms. But in case of Carlton Bond as well as the Maitland, it requires somewhat more time to give some relief to the patient. So if patient will feel some severe pain, so if we will apply the Mulligan, patient will relieve the symptom immediately. But in case of Maitland, it will take 1 or 2 sessions to relieve the symptoms.
Thank you so much, Dr. Varun. Alka is asking here, what are the indications of Mulligan technique?
You're not audible.
Yeah. Alka is asking here, what are the indications of Mulligan technique?
Okay, so here actually when person is having some pain as well as the joint stiffness, so these are the two main indications where we have to apply the Mulligan mobilization. So if patient is unable to move the joint, so in that case also we have to give the mobilization. So some other indications are also there. For example, if I will go for some specific condition, after the ankle sprain or the set sprain, so when patient will get cure, when the patient will get relief, so there are lots of chances that for the longer duration, patient will report a severe pain on the lateral aspect of the ankle joint. So in that case, what will happen? So here we have the two malleoli, one on the middle side, one on the lateral side. And in between, we have one bone, that is the talus. So when this ankle joint will just go for any tearing, okay, wear and tear, so it will shift the position of the lateral malleoli. So in that case, if we will not give the Mulligan mobilization, so patient will take a lot of time to again relocate its own malleoli. So in that case, if you will apply the Mulligan mobilization, so with a single setting only, it will report a 0% of the application of the technique. So that in that way, actually, we can say there are lots of indication. The main indication is the pain as well as the joint stiffness.
Thank you so much, Dr. Varun. I hope all the participants got their answer from our expert, Dr. Varun. If anyone have any query, they just write on the admission at lpu.co.in. Our experts will definitely address your queries as soon as possible. So as we come to the end of this webinar, I want to express my deepest gratitude to our experts for sharing their valuable insights and expertise with us. Your presence, enthusiasm, and active participation have made this experience truly special. Hopefully, the attendees found this webinar to be valuable and will be able to utilize the information for better decision making regarding your admissions. If anyone wants to access this webinar again, they can visit our website, that is lpu.in, or can be accessed on YouTube also. Stay connected with us for future webinars. Until we meet again, with the permission of my seniors, I would be signing off this webinar. Take care and goodbye. Have a beautiful day.